Hello, welcome back to the channel. My name's Ed, your friendly neighborhood doctor, and today we're going to be breaking down another episode of Scrubs. We've already done the first 2 episodes of the first season, so this is episode 3 called My Best Friend's Mistake.
In my gut, I know I'm right.
We need to make this decision now.
Fine, then it's on you.
Yes, it is. Nurse, erasure.
Yes, doctor.
Just gonna stop that before I get a copyright strike. Playing music in a surgical theatre, yeah, we've seen that a lot in TV and movies, and it's absolutely a thing. I would say it's not super common. It really depends on the operating team and mainly the surgeon in charge, whether they want to hear something or whether they'll let everyone else listen to music. And sometimes when there's real critical moments, so they're doing a particular delicate part of the procedure, they will ask the music to be turned off.
I hate this song.
Me too, man. Me too.
Having said there's normally music playing, the patient is normally under a general anaesthetic, so asleep before they start putting the music on. I think that's generally the way to do it.
Weird, but a hospital room can actually be kind of a romantic place. Maybe it's the soft green glow of a heart monitor, or the way the moonlight reflects off a bedpan.
Clearly, JD is messing around here. More realistically, I can't imagine anywhere less romantic. Although I have heard rumours of people sneaking off with romantic endeavours, but these are all just rumours. I can't imagine anywhere less romantic than alarms constantly going off, bright luminescent light coming from the ceiling, and strange smells, everything from urine to infected ulcers to weird kind of bleachy smells. Although I don't want to kink shame anyone, that people might be into some of those things.
Look, this guy's gonna need 40 MEQs at KCL, and go ahead and grab me when you get the results.
You got it.
So 40 mLs of KCL, so potassium chloride. This patient is hypokalemic, so they've got low potassium. Low potassium can be caused by a variety of different reasons. Dehydration, some medications that you're on, just being generally unwell as well can cause electrolyte imbalance. And the main thing we worry about with low potassium is it can cause heart arrhythmias. And we can be reassured that currently isn't happening, because at the beginning of the scene here, we saw the patient's on a cardiac monitor. It's got a heart rate of 60 and the trace of the heart looks completely normal. And Dr. Cox is recommending giving this guy 40 millimoles. That's around about half what your daily requirement would be. We say it's around 1 millimole per kilogram. So someone like me, 70 kilograms, I'd need 70 millimoles a day. It's very important though to give it slowly, because what you really don't want to do is send someone into hyperkalemia, so too much potassium, and again, that can cause cardiac arrhythmias, so heart arrhythmias that can kill you pretty quickly. And so another good learning point, that anyone with major electrolyte disturbance should be on a cardiac monitor.
Dude, I got to close for the first time ever. Ever. The human body is so disgusting. No, not yours. Yours is stunning.
Yeah, so this is quite a major thing, a bit of a rite of passage when you're first allowed to close up. I witnessed plenty of my colleagues say this exact thing to me, very pleasing thing for them to do and very important step in their journey. I think for me, a similar thing was when I first got to sort of close up a laceration within the emergency department, equally rewarding.
Gang, it's time for rounds. Let's see who's the weakest link.
Okay, here we go. Pressure's on. I'm going to try and answer. Dr. Kelso's ward round questions.
Now then, Dr. Simotis, the severe swelling of the lips exhibited by this patient might be an indication of what?
Severe swelling of the lips might be an indication. I'm going to say angioedema. I'm quite confident on this. Let's see.
Angioedema.
Well done.
Woohoo! God, I shouldn't be so pleased with that. It's just a medical TV show.
And what treatment would you recommend, Dr. Dorian?
Okay, treatment for angioedema. It's an allergic type reaction, so you want to go antihistamines and steroids. Also really important to remove the actual trigger, so the actual cause of the angioedema. So It could be a certain medication. Typically, ACE inhibitors, medication given to blood pressure, can cause this. Let's see if we agree.
Combination of steroids and any of several antihistamines?
Attaboy, sport.
Still got it, baby.
Now then, what would you recommend the patient stay away from, Dr. Reed?
What should the patient stay away from? I guess the thing that triggered the reaction? I can't think of anything specific they should stay away from.
My first guess would be shellfish.
Right you are, sweetheart.
Shellfish. There you go. Shellfish is another common allergen that could cause this reaction, but I guess lots of other things could cause it. So I mean, I didn't get it right, so I guess I can't give myself 3 out of 3, just 2 out of 3.
Was 2 out of 3, baby.
He'll have a whole new level of respect for you.
Honestly?
Yes, you can't have sexist terms like that floating around here. You go get them.
So this is definitely something that's coming out a lot more nowadays, the way women are treated in medicine. It's a cliche, but particularly in certain specialties. I mean, surgery being the one to spring to mind, but I don't want to perpetuate a particular stereotype, but there was a recent article in the Times sharing lots of stories of surgeons that are women and their experience of sexism within the workplace and the systems in general, kind of like a Me Too moment, but within medicine. So we've seen 2 senior doctors, Dr. Kelso using sexist language, Dr. Cox sexually harassing Elliot by slapping her bum. And this stuff is still happening. This episode of Scrubs is 20 years old, and we're still seeing this type of behavior ingrained into the medical profession.
Okay, this guy looks stable, but I still want to get an EKG. Let's do cardiac enzymes and
Sweetheart, no.
and an aspirin.
Okay, so JD's suspicious this chap has had a cardiac event, so wants to rule out a heart attack. So he's going to be doing an ECG, but also a troponin blood test. So troponin is an enzyme that's inside the cell, so inside the muscle cells of the heart. So if we do a blood test and we find troponin in the blood, it means some of those heart cells have died and released their contents into the bloodstream.
A lot of my work has become second nature to me. The only problem is that it gets...
I think, did JD just put his stethoscope in the wrong way here? Let's have a look.
second nature to me.
Yeah, he just put his stethoscope the wrong way into his ears, which is a really common thing that you see medical students do. And so here's my stethoscope, and you're kind of set up to fail because you can see that they face a particular direction, and intuitively you'd think because your ears are behind you, you open it up like this and put the stethoscope round this way. But then when you think about it, that's not how you put in-ear headphones in. You definitely put them from the back to the front. So actually that's the way round you want your stethoscope, because you've kind of got the tragus here, you want to go behind that, and so they nestle in nicely inside the ear like that, and that's the only way you're going to get them to fit well. So I definitely made this mistake as a medical student, but JD here, as a doctor who's gone all the way through medical school, that would be extremely worrying to see.
Never easy to see a patient that's getting worse instead of better. In fact, that's kind of the opposite of what we're going for. I don't get it. He was fine last night. Now he's diaphoretic, he's in and out of consciousness. He might even be septic.
So this guy is post-op. So the 2 major complications you worry about in the short term are bleeding and infection. We don't know the specific operation that was done in this patient, but I think it was on the bowel. So any kind of damage to the bowel during the procedure, we can get the bowel contents to leak out into the abdominal cavity, which can cause an infection we call peritonitis, which can kill you extremely quickly and would turn you septic. So the inflammatory process would end up damaging your organs, which is kind of what we're seeing here. The guy's got a reduced level of consciousness. But any change in a patient's state, you need to do a full assessment to make sure you're not missing anything.
Well, we won't know anything until the lab gets his blood work back.
If he's septic, there's a chance they'll have to reopen this guy. Of course, there's also a chance he could die.
It's not totally true that we have to wait for initial blood tests. They can take a couple of hours, but we can do some bedside blood tests as well. We can also just look at the patient in front of us. So if they're spiking a fever and becoming more unwell, and they've recently had an operation, you would just treat for sepsis. So giving them fluids, antibiotics, oxygen if they need it, and keep a very close eye on them. And as JD said here, get an urgent review by the surgical team. They might want to do some investigations, some more imaging, or they might want to take them straight into theatre if they think there's some bleeding, or if the bowel has burst and they're worried about peritonitis.
I've seen this before. Gauze, sponges. Some young surgeon left something in this man.
No, I know the guy that closed. He'd never be that careless.
Okay, and so there's a suspicion that something's been left in the patient. That's a pretty bold thing to jump to straight away. I'm not saying this doesn't happen, but it's far more likely that it's just an unfortunate complication rather than jump to negligence that something's been left in there. Because this is a conceivable mistake to happen, that instruments and gauze can be left in a patient, everything is counted at the beginning of surgery and then counted back in at the end. So the instruments are often weighed as well, because if there was one thing missing, then it would weigh less. If the unthinkable happens and some gauze is left in the patient, then there is a backup plan. There's actually a piece of metal sewn into the gauze so that when you x-ray it, you can actually see that it's been left in.
Excuse me, sorry. Has anyone seen my keys? No? Okay, how about my wallet? Anyone?
I thought for a minute there the implication was that he'd left his keys and wallet in the patient, which, I mean, that would be something way out there. Leaving anything in the patient is called a never event, but leaving your wallet and your keys, what, like a never ever ever event?
Hi. What happened?
There's no infection. He's diabetic, so when someone gave him insulin during post-op, when he wasn't eating, he became hypoglycemic.
Oh, that's funny, because the only person who could have given him insulin... Uh-oh. I gave him insulin. Twice.
Oh, he's fine, Bambi. I gave him an amp of D50 and he's eating now. But you should probably give him a glass of orange juice in about an hour.
Carla, thank you so much. You totally saved my ass.
No, it wasn't me.
Wait, so there you go. It was JD that actually gave the patient insulin. The patient was still nil by mouth, so wasn't eating, so didn't need it. So the most important thing is the outcome for the patient, but that could have been really serious. If your blood sugar goes super low, it can kill you. As we said earlier, one of the initial things JD should have done would be a full assessment, including looking at the drug chart, but also a bedside blood test, what we call a VBG, which would have shown the low glucose and would have given us an idea that that was the cause of his reduced consciousness.
Look, Turk.
Come on, man. You know I always got your back.
I know. Just tell him how you feel without sounding like a girl for once. I miss you so much it hurts sometimes.
Okay, you've had a rough day, so I'm gonna let that go for now. Thank you.
And there you have it, another brilliant episode of Scrubs. One that I too got sucked into the twist that Turk had made the error. And so I hope you've enjoyed my thoughts on this episode. If you have, then please give this video a like and consider subscribing too, because I'm quite keen to work my way through the whole of the first season, because there's so many good storylines, there's so much good medicine to talk about. And please leave a comment if there's anything that I've missed or any other episodes that you particularly enjoy that you want me to check out. Thanks again so much for all your continued support on the channel. I hope you're all well, and I'll be back soon.